This is Reed's case number 640. We're going to use the stitched image approach in analyzing it in the hopes it stimulates you to use this method for looking at the case. These are his cone beams. It's obviously a necrotic tooth. He did cut the crown off, which was nice because it got the formalin in the root right away. This is how I got the tooth. And those are my radiographs. These are his clinical pictures of the instrumentation. And that's what the mesial root looked like before I sectioned it. That's an axial view of the MB1 and MB2 canal. And after sectioning it, that's my radiographs. Was well instrumented, but when we sectioned it, there was still quite a bit of pulp still present in both the MB1 and MB2 roots. So we're going to take a look at that. After it was dehydrated, it looks kind of like that. All the tissue shrinks up and the proteins precipitate a little bit. There was a sinus tract on this. There were circumferential radiolucencies. So the diagnosis was pulp necrosis, chronic apical periodontitis. These are his measurements. He did take the MB2 out to a size 30, and this is his irrigation solutions and what he used. He used a Furtana laser with sweeps with 7.5% sodium hypochlorite and Triton. So before we look at the stitched images, let's just review quickly how Denton demineralizes. If you take one of his sections and look at an area where you can actually see the canal wall, where maybe some of the soft tissue has pulled away from the wall, and when you can look at this, it looks like it's the predentin is being demineralized, and when it demineralizes, it does give an appearance of a biofilm kind of morphology. And when you look closely, even at the soft tissue, it looks like you have an area where there are morphotypes, but these are not bacterial morphotypes. This is how demineralization occurs. If you look at Christoph's pictures from a size point of view, you can see that sometimes these bacteria can be just 100 nanometers wide. So those decalcification spicules can be, they're on the small side, I agree, but so you have to be careful. And when you go into the stitched image on the MIE site, let's go ahead and look at the lower power stitched images first. It's very difficult to stitch these images when I cannot make the canals perfectly parallel to each other. So I'd like you to spend some time, look at what the soft tissue looks like after it's been dehydrated, get a sense for what that looks like, and then take a look at the debris on the canal wall. This canal wall actually in some areas looks very, very clean. Not like Reed's other case with the Triton, which was much cleaner. And there you get a look at what some of the remaining pulp actually looks like. It's quite thick. The tissue left over had quite a bit of thickness. When you go into the little higher power stitched images, I hope you can see the advantage of reviewing the case using this stitched image approach. You get a sense for the overall cleanliness of the canal, and here you can see either predentin that has not been removed or instrumentation debris, and there you can see kind of the smear layer. That's the smear layer, and here you can see some pulpal tissue with a lot of red blood cells, of course, but and there you get a sense for the thickness of the pulp tissue, the remaining pulp tissue that's still there. So looking at this overall with the stitched approach, you get a pretty good sense of how clean the canal was and what the canal wall actually looked like. Now here you can see it doesn't give the laser signature, which is Ditch Denton, and here you can see quite a bit of instrumentation debris and probably pre-Denton, which has not been removed and is still on the canal wall. And then you have other areas where the smear layer is pretty well condensed down and hasn't been completely demineralized. And then you have other areas where there's pulpal tissue still there. We'll take a look at that area where you can actually see the underlying mineralization front underneath the soft tissue that's still present. And here you can see this is a lot of hemorrhagic pulpal tissue still present on the wall. Going into a little higher power stitched image, now you get a sense of the actual mineralization front and the smear layer over the top of the mineralization front. And here you can see the start of the pre-dentin being demineralized. And there's where I find the laser signature. This pleated look is very characteristic of laser use, and I have not seen that where the laser is not used. You'll see this occasionally with GentleWave too. You get the layered look of the pre-dentin, which has not been completely decalcified or demineralized. And here's a little bit higher magnification stitched image. And here you can see the mineralization front is starting to be demineralized, but you still can't see any dentin tubules. So there's a wide variety of findings in this tooth. When you really look at it carefully, there's areas that where you can see patent dentinal tubules, and other areas where there's a lot of pulpal tissue still present. Now this is not a stitched image, but a collage image that allows you to go in and zoom at various powers in different areas. Here you get a sense of the demineralized layer with some pre-dentin that hasn't been removed, or perhaps it's instrumentation debris. We're all learning how to read these because typically in the literature, they've never looked at teeth like this. So, and there you can see something that looks like a biofilm. That's just the demineralization of the pre-dentin. That's what demineralized pre-dentin looks like. Looks like organisms, but it isn't. And there you can see there's still proteoglycan still in the dentinal tubules that has not been removed by the bleach or the demineralization. I will say that in looking at this case, even though it was necrotic and very infected, I was not able to find any bacterial morphotypes at all. I was not able to find any bacterial morphotypes at all.